Yes, I'm Hubert. I'm a hematologist-oncologist at the University of Frankfurt, and I'm heading a subunit of the German Consortium for Translational Cancer Research. It's called the Clinical Communication Platform, which I will present in the afternoon. So the German Consortium for Translational Cancer Research is an initiative by the federal government of Germany, where the German Cancer Research Center, the DKFZ in Heidelberg, partners up with 7 universities throughout the country to further translational cancer research. And there are several scientific work groups within this consortium and technological platforms that cover the whole spectrum of cancer research as it becomes available into the clinic. And it's a funded organization, it's a funded consortium funded by the federal government and the Helmholtz-Gemeinschaft. The clinical communication platform is one of the technical platforms, one of the platforms within this consortium, and it has the task to first coordinate scientific work groups, technical platforms, and clinicians within the consortium to bring results from the lab into the clinics, and on the other hand to exploit the data that come out of clinical trials and put them back into the labs. So it's a coordination platform. There will be a central clinical trial bureau that takes up all this coordination efforts. The second important task of the clinical communication platform is to help the decision boards of the consortium to prioritize, to review, and to monitor clinical trial activities within the consortium. And the third, and I think most important task of the clinical communication platform is actually to provide an improved patient base for molecularly targeted, molecularly stratified clinical trials. And the patient workflow is that any patient that enters a hospital that is part of the consortium will be registered in a database. We will register a few data only, and then we'll allow by IT solutions for decentralized search in the databases of the admitting hospitals, so that we will have a collection of patients. And what's more important is that there will be informed consent of the patients to be part of a system where a diagnostic material of the patient's tumors is stored, and this diagnostic material is subjected to diagnostic procedures. We have a molecular diagnostics platform within the consortium, and there will be a constant flow of new technologies for next generation sequencing, for clinical proteomics, and so on. So that whenever a clinical trial comes up in the future, after the patients are in this system, we hope to be able to provide on-the-spot patients for these clinical trials, stratified for molecular markers and for clinical inclusion criteria. We hope that in this way we can overcome one of the major hurdles of current translational cancer research, and that is that it takes too long for early clinical trials to fill and to recruit. And we think that by enhancing the patient base, this will be significantly a better way of including patients into these trials. So some of the sites of the consortium are actually regional consortia of hospitals. So in Frankfurt, it's the site Frankfurt-Mainz, which are 2 cities that are very close. And there are 10 hospitals included in this, in the region alone. But we envision that the whole consortium will have at least 15,000 to 20,000 new cancer patients every year. And we hope that in 5 years we will have the system running so that indeed every patient that enters a hospital in this consortium will be part of the system. What we think is that this system will be so attractive for for institutions or industry developing drugs clinically and doing clinical development, that they will open up the consortium as a multi-site partner. They will, that's our idea, will enter strategic partnerships with the consortium, and then all sites of the consortium will be open for inclusion into the trials, because, and it's very likely that the principal investigator will be sitting in one or the other of the partner institutions, depending on the trial. So no, the patients won't have to move all the time. That will be the case for some rare entities, but in general, we plan to open up the trials at each of the sites in the consortium. This is at the moment a government-funded consortium. The government funds are considerable. We also think that once the consortium has started, and this will be in this summer, that we will have strategic partnerships with industry for industry funding.
Okay, thank you.